Hi everyone. I am lucky enough to be a pediatrician locally here. My office is down in Mansfield. I've been there since 2003, January 2003 I opened up. I've gotten to know a lot of families from the community, and one of the families that I've been lucky enough to get to know is the Lewis family. I'm here today sharing because I think it's important that we spread some awareness about this this infection that I think so many people don't know about. And so I was lucky enough to be asked by Jeremy to come and share a little bit about the medical side of this illness. So we're going to talk about today Naegleria fowleri and primary amoebic meningoencephalitis. That's a mouthful. I'll probably call it NF or PAM for short, so you might hear me refer to it in both of those ways. So when we get started here, what is Naegleria fowleri? Well, it's an amoeba, which is a single-celled organism that's commonly found in our environment, in fresh water and in the soil. Prior to about 50 years ago, the medical community thought that these amoeba were completely benign, that they had no negative consequences in humans. We had no idea that they caused diseases. But over the past 50 years or so, there's been some expansive knowledge in this field, and we know that amoebas can in fact cause disease. Naegleria fowleri causes an infection called PAM, or primary amoebic meningoencephalitis. And what this infection is, it's a brain infection that leads to destruction of brain tissue. The scary thing about it is it's a primary infection. What that means, it's the first infection. So this disease affects healthy people, healthy individuals with they don't have to have risk factors. It affects healthy people. And the very scary and frightening thing about it is that it's almost always deadly. If we look at a history of NF in the United States, between 1937 and 2007, there were only 121 cases recorded. In the year 2008, so just 1 year, there were 6 deaths alone noted in that year. If you look worldwide, kind of spread your scope and look worldwide, there's only been 200 confirmed cases of this disease. However, it appears that it would be kind of a rare disease, but I think one thing that we are just recognizing is that this has been very underdiagnosed. If you look at in the hospital records, codes for deaths from encephalitis, there's about 1,400 deaths per year in the United States. Well, 60% of those are from unknown causes, so that leaves up to 840 cases a year or so that we don't know what the cause is. I think it's very reasonable to say that when we're not looking for a specific disease, we don't know what the cause is. So I think it's very reasonable to say that the Naegleria fowleri may in fact be the cause of some of these unknown cases. Recently, there have been, in 2011, in the summer, there were 3 deaths, one from Florida, one from Virginia, one from Louisiana, that were reported by about August. 1 month later, there was another death found in Kansas. And then shortly after that, there have been, now in the past few months, 2 deaths reported from this particular infection from people using neti pots to clean out their sinuses. And we'll get into that in just a minute. So we kind of ask, well, where is this Naegleria fowleri found? Well, it's all over the world in fresh water. In the United States, it's found especially in the southern states where the temperatures get a little bit warmer. It can be found in lakes and rivers, in hot springs, in warm water discharge from industrial plants. When I was researching and learned that, it scared me a little bit. One of the things that I loved, I grew up here in Arlington, as she had mentioned, and we used to go to Eagle Mountain Lake all the time and ride jet skis, and I had this one little cove that I loved to ride in because it was the warm water. And now, thinking back, I was jumping and playing in that water my entire childhood. I think back, that was one of the really dangerous spots, and I had no idea. It's part of the reason why I think it's important that we start spreading the awareness about this infection. This can also be found in underchlorinated swimming pools and in tap water, we now know, and also in soil. The really dangerous places are places where people are swimming. David Finfrock, a local newscaster, weather forecaster here, did a story last summer that kind of shared Kyle's story, and it was back, as most of us remember, the very hot summer last year. This was talking about the lake temperatures, and you can see every one of the lakes in this area had temperatures, you know, at the high 80s and above. Well, we know that this infection flourishes in water temperatures above 80 degrees. This is not just last year. The temperatures in the water and lakes in Texas and rivers is always above 80 degrees in the summer. And in fact, across most of the southern United States, that's true. We try to talk about how this infection happens. Well, the water from in an infected area has to enter the nose somewhat forcefully. The amoeba then grabs onto the olfactory nerve and travels up into the brain. We know that most of the people exposed to this amoeba will not develop the PAM, or primary amoebic meningoencephalitis. We've been able to culture this amoeba from the nose and throats of healthy people. But if you're unlucky enough to get the water in there forcefully and it finds its way onto that olfactory nerve, that's when it can cause this fulminant disease. I think it's important to note that you can't get this from drinking the water. It has to go into the nose. That's why the neti pots are becoming more and more of a concern. What are the symptoms like? Oh, the infections do occur usually in the summer months, but it can be any time of the year, particularly if you're in hot springs or, again, using a device like a neti pot. The symptoms are very similar to meningitis, bacterial and viral meningitis. Starts off with fever and headaches. The headaches are not like a normal headache. They usually won't respond to Tylenol or Motrin. The fever can be anything from just a very low-grade fever, around 100, all the way up to maybe a 105 fever. As things progress, there can be changes in the sense of smell or taste. Sometimes children will complain of a stiff neck, or adults will complain of a stiff neck. Further along in the illness, vomiting occurs, lethargy, become very tired, possibly seizures. Further along, you start to not recognize the surroundings, the people that you love and know, don't know where you are. A lot of confusion develops. And almost inevitably, within 3 to 10 days, death occurs. So how do we diagnose this? Well, it's difficult to diagnose. Most of the confirmed cases have been diagnosed after death at autopsy, when we're trying to figure out what it was that caused this very rapid progression. The spinal fluid will show mild to moderate changes, very similar to viral or bacterial meningitis. Oftentimes the CT scan is done, and that's usually normal early on in the disease. There's nothing that shows up on those types of scans until the disease has progressed, and then some brain swelling will occur. The real key here is that without a high index of suspicion, doctors aren't looking for the amoeba. You can see it if you know what you're looking for under the microscope. Unfortunately, when we're not asking the right questions, we aren't asking, have you recently been swimming? Have you used a neti pot recently? These are things that would increase the index of suspicion for a doctor and make them tell the pathologist, okay, you need to look and see if you can see this amoeba under the microscope. Talking about treatment, I think first off the bat there is no good treatment. Right now the mainstay of treatment is amphotericin B, given either through the IV or directly into the spinal fluid. This has not been a very effective treatment, and it has some serious side effects. Other medications have been tried, everything from general antibiotics. Again, usually it's assumed that this is a bacterial meningitis, so lots of different antibiotics have been tried. Antiviral medications have been tried, really none with any success. Ultimately, until we can do some good studies and recognize this disease before death happens, we're not going to be able to figure out what treatments are going to work. Prevention is what I think is, to me, the most important part of this. How do we prevent this disease from happening? Well, properly cleaning and chlorinating swimming pools and drinking water supplies. Avoiding water activities in fresh water when the water temperatures are high or above 80. And again, in the summertime in Texas, that's going to be every summer starting probably June, July, probably June. If you do, and again, I'm one of those kids, I grew up here in Texas, we were on the lake, and I know people say, I'm not going to stay off of the lake. I've had family members of mine knowing this story still say, we're going to go to the lake. Well, then use nose clips. Don't let your head go underwater, especially with children. Hold their nose tightly if you're going to jump in. Nose clips are probably the most effective at preventing a forceful gush of water going in the nose. If you're going to irrigate your sinuses using a neti pot, then use distilled or boiled water. I'm going to read a quote from the CDC that was put out last summer, and I think that this sort of sums up the information about this disease. It says, because PAM is a rare disease, it does not generate a high index of suspicion among healthcare workers. Symptoms of Naegleria fowleri infection are clinically similar to those for bacterial or viral meningitis, further lowering the index of suspicion for PAM and initiation of appropriate diagnostic testing. Making PAM a nationally notifiable condition might improve case detection through increased awareness, reporting, and information about cases. Such information might enable earlier detection of infections, provide insight into human or environmental determinants of infection, and allow improved assessment of treatment effectiveness. This is again written by the CDC. So what they're saying is there are a set of diseases that are nationally notifiable diseases, that if a patient comes into a hospital and is diagnosed with this particular infection, it has to be reported to the CDC. Once a disease reaches that level, then a lot more information is made aware. Number one, doctors are informed about this disease better, so that when a case comes in the summer of meningitis and there's no real clear cause, we start to look for the right things. So the push right now, I think, needs to be to make this a nationally notifiable disease so we can gain more information about it. Again, that's kind of my spiel on the medical side of this infection. If you guys have any questions about it, come ask me afterwards, or you can write questions on my website, jt-md.com. There's a link to contact me directly, and I'd be happy to answer any questions.